Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about those stubborn teeth that you're trying to upright, some of the struggles that you might be having, kind of the mental checklist that I go through to try to figure out what the issue is. So let's kind of walk through those checklists. This is in no particular order, but this is kind of what I want you to do. So first of all, just to clear up any misconception, I do have other videos, especially in my Invisalign playlist on my YouTube channel, that talk about molar uprighting. I'm specifically talking about aligners right now. I'm not talking about braces. Braces, but similar. Some of the stuff will still apply for braces. So I'm talking, and it is 100% possible to upright molars if you pick the right case with Invisalign or ClearCorrect. 100% done it all the time, like really hard ones. So I just want to clarify that you do not have to place braces. Now, of course, your first thing, since we're talking about that, is compliance. Your patient has to wear it. So, I mean, if they're not wearing it 22.5 to 23 hours a day, it will not work. You won't even get any improvement. So that's number one. So I always want to put these patients, I want to pick my patient carefully, but I always want to put them on a virtual accountability loop. If you don't know what virtual check-ins are, please watch all my other videos I have on virtual check-ins. If you're using Invisalign, it's free. It's called Invisalign Virtual Care with AI. That's free. You should totally be using it for these kind of cases. If you're using another aligner system, I recommend dental monitoring or in-hand dental. In-hand dental is about 10% of the price of DM. And I can get you a really good price. Email me if you want an info@straightsmilesolutions.com. So let's put that aside. And I'm going to reference other videos you're going to want to watch first in order to understand these concepts better. So check out my Invisalign playlist. If you can't find it, you can email me and I'll send it to you. And it's free. Okay, next thing you want to do is you want to make sure, like let's say, and I'm just giving this as an example, but if you're uprighting a molar, it's not going to work very well if there's one behind it. So, I mean, I'm not saying you can't do it, but it's going to be 10 times harder and it might not be possible. So usually you're going to want to extract that wisdom tooth. So chuck out those eights before you try to upright the molar. It's just probably not going to work and you're probably just going to burn the roots. So no point in trying. Would be my suggestion. Why lose two teeth when you could just take out the wisdom tooth and upright this one easily? So that's just an example. Extract the wisdom tooth would be the next point. Next one would be is I like to put a buccal and a lingual or a buccal and a palatal attachment on. So 2 attachments, 2 handles. More handles are better, okay? You cannot do this without attachments. So if you got a crown on the tooth, this may not work. So that's another thing, no crowns. Or if you have a porcelain crown, you can try porcetch. I find it on this situation, it doesn't really work. If it's an old porcelain, sometimes you can, rough it up and use the HF in order to bond. But if it's a nice crown, forget it. It's not going to work. If it's a gold crown, forget it. It's not going to work. Sorry. You could cut it off. You could put a temp on, give it a try. That would be the other option. But yeah, no crowns. Okay. Other thing you want to check is you want to check your crown to root ratio, just like any tree that's in the ground. Okay. If your crown to root ratio isn't good, if you have a lot of loss of attachment or short roots, this darn thing going to fall out what you try to do it. And you're going to end up with severe perio issues and it's just not going to survive. Prognosis is going to be bad. Always, if you're not sure, I want to see at least a 1-to-1 crown to root ratio, at least like half roots in the bone, half, that's what I'm talking about. If it's lopsided, forget it. Don't do it. If you're not sure, send it to an actual periodontist and have them give the prognosis. No sense in trying something for a year to year and a half and having it fail. The patient's going to be mad and you're going to get sued. Okay. So don't, if you're not sure, let the periodontist make the call and they need to give you a report with the prognosis in writing. That way, if it fails, it's not on you, it's on them. Next thing you want to check is the occlusion. So first thing I'm going to do before I even do this is I'm going to use articulating paper. Don't go by the iTero because a lot of times it's not right. Tap, tap, grind, grind. If it's high on the part where we're trying to upright, it's not going to work. So you may have to do some occlusal equilibration first before you scan. Or sometimes you can do some anterior bite turbos to lift it, but it usually works better to do both. Again, anterior bite turbos, if you're not sure what that is, I've got, just search by keyword in my channel. There's 1,500 videos. It's there. Let's see. And then I guess the last thing is going to be the trays. Sometimes, and I just saw this recently, I see Clinchecks all the time, but one of the issues with Invisalign that's a good thing is like a lot of times they'll work around like undercuts and stuff like that with the trim, which is really nice and it's healthy, but it's also not nice when you're trying to upright a tooth. So you really need full coverage. So sometimes it works. Yeah, you may have to send for a warranty fit. If you're not getting the coverage you need, I want it wrapped all the way around this tooth. I mean, this tooth needs to be gone, so it needs to be all the way around the tooth. If they're doing weird trims, you got to send that back and have them trim it better. You know, like it needs on that tooth, we need full wraparound coverage of that tooth with the buccal and lingual attachment. It needs to be getting in there. And a lot of times, you know, they're blocking out undercuts, but we really have to get under there to the point where it might be hard to snap the darn thing on. So you're going to have to work with them on that. And a lot of times you don't know what the tray looks like till you get it. So inspect your tray. If you don't have full coverage on that tooth, send it back, do a warranty fit, but you're going to have to call them and explain what you want because you can't really go back and forth on a Clin Check about that. That's a phone call. Sometimes ClearCorrect is better for stuff like that, you know, but then again, it also can get locked on. So it's a trade-off. So that's pretty much it. And then, oh, lastly, I forgot the most important one, pathology. If you've eliminated all this other stuff that I mentioned and you don't see any reason why it shouldn't be going, two other things, sorry. Take a CBCT ideally and look at the roots. I want to see a nice lamina dura in the PDL. I want to see it looking nice and healthy, not inflamed, not widened, not ankylosed. I mean, you can't always tell. CBCT is better. Let someone read the bone. I mean, sometimes you've got areas of bone that just are either too dense or have pathology, and it's just not going to happen. So, I mean, if you're really running out of ideas, have it professionally read by a beam readers or equivalent. I've seen this happen. It's not common, but you know, better to find that one out before you spend a couple years trying to do something that's not going to happen and get the patient really upset. It's not going to happen. It's not going to happen. And then, yeah, you got that issue, bone issues. Yeah. I mean, that's pretty much it. Occlusion, tray. Oh, yeah, one more thing. Sometimes you're gonna have the height of contour of let's say this was actually up against this, okay? I'm just, you know, I didn't have a picture that I could actually show you that I had a release on, but let's say this had like a big height of contour or a filling. Sometimes you have to recontour the fillings. Sometimes if it's so tipped and it's under the height of contour, it's easier to use the spacer technique first. It's just locked up. So if you don't know what the spacer technique is, go into my channel, I think it's called Spacer Technique, the video, but you could just search by keyword spacer. I think it's a purple colored video. And for a month or two first, you're going to use the spacer technique only if this tooth's out, only if there's nothing behind it to upright it over the height of contour. Then you can finish it in Invisalign. There's no way you're probably going to get Invisalign to push it down and back. You need to pop it over the height of contour first. It's not hard. It takes a few appointments, like 4 to 6, 4 to 8 every week or so. It's a commitment, the spacer technique, but it works. So, all right. Hopefully that was helpful. Thanks so much.